So our next speaker is Tom Denny. Tom is professor of medicine here at Duke. He's the chief operating officer of the Duke Human Vaccine Institute. DHVI has been quite a prominent member within the Duke CFAR. Tom has been extremely helpful to us at the Kilimanjaro Christian Medical Center, and he came and stayed with us, visited with us. Some of my favorite memories were sitting on the front porch with him, going to the lime tree to knock down a lime for our gin and tonics. So, Tom, you're welcome again.
Thanks, John. I'm glad we stopped at the gin and tonic part. And thanks to Kent also for having me. So I don't have a lot of exciting data to show, but what I hope I'll outline for you is an exciting venture that we're beginning to undertake, leveraging a number of Duke resources that we hope in the coming years will have exciting opportunities for folks to do work and to come back and present some exciting science. So over the last 20 or 30 years, you all have woke up, some of us a little bit older, have woke up a few more mornings reading these headlines of some emerging or re-emerging pathogens. Over that period of time, we've developed tools to help deal with some of them. Some of them have been contained or sort of kept in place. Some of them have gone away. Some keep coming back to visit us again well into our current time. And we don't have to look too far, but to think about the current Ebola epidemic going through Africa. And just this week, CDC came out with a projection that says by January there could be close to 1.4 million people infected with this bug. And yet, no effective vaccine or therapeutic to deal with it. So at the Vaccine Institute, our mission statement sort of is to develop vaccines or therapeutic agents to deal with the societal threats, help to train the next generation of scientists, and hopefully in doing all this, not be a financial burden to Duke enterprise itself. So hopefully we're able to go out there, recruit revenue, grants, and the resources to support these activities. So what over the last, and then most of you know, on the Duke campus here, as part of the Vaccine Institute, we have the Regional Biologic Containment Facility that is set up to handle up to BSL-3 pathogens, so-called select agents we can work with in this facility. We can do experiments where we have one of these BSL-3 pathogens. We can expose animals to it. We can study the animal to see how this pathogen affects them. If we have a countermeasure, if you will, a vaccine or a therapeutic antibody to help contain that pathogen, we can administer it to the animals and then challenge them to see if we got a protection, or you can challenge animals first and then give them the antibody and see if you can contain the disease from expanding. And we have a number of tools here that can that help us do that. In Singapore, there are 5 signature research programs, and one of them is headed by Lin-Fa Wang, which is the Emerging Infectious Disease Program. And Lin-Fa and our team started talking about 6 months ago, what could we do to work together, and how could we leverage resources that we have on both campuses and build something new. And then that expanded quickly to bring in Chris Woods in the Global Health Institute, because we have a number of tools between Lin-Fa's team and our team, but Chris is out in the field around the world and has the so-called listening posts. He has the surveillance programs out there where he's able to gain access to samples of folks with, folks that report with a fever of undetermined origin that you may want to get a sample for and be able to begin a pathogen discovery process or then map immune responses. So at the Vaccine Institute, our mode of operation, if you will, over the last 5 to 8 years as we've worked very hard on an HIV vaccine is sort of this pathway of basically taking basic science and working on samples from individuals that have an infection or have been on a vaccine trial, characterizing them a lot, and then using that information to help to design new interventions, new vaccines or new therapeutic tools. And in doing that, we now have a number of products that we are bringing through GMP production that will go out into clinical trials. Some of these are further down the path than others. Some will happen within the next 18 months. Some are probably still another 24 months out. But we have a number of different approaches at coming up with a protection to HIV that have all come out of the Vaccine Institute and sort of the basic research pipeline or translational pipeline that we've developed over the last 5 to 10 years. So the partnership that we're putting together currently is sort of these rings, if you will, that builds on the strength of the pathogen discovery program in Singapore, what we're calling our DHVI discovery team, and that really is all of the Vaccine Institute here locally. Bart Haynes' team, Larry Liao, Munir Alam, Georgia Tamaris, work we do with Kent and his team, so all the different investigators that are part of the Vaccine Institute, and then Chris Woods and his surveillance team. And the idea would be that as Chris is out there in the field getting samples collected, we could get them into Singapore, and Linfa's team could do pathogen discovery type work and provide access to those samples to a team that would be working in the center that we hope to create in Singapore that we're calling right now Center for Countermeasures to Emerging Infections. And what we're proposing is the first platform that we hope to make operational in Singapore is sort of a platform that Bart and Georgia and Garnett Kelso has sort of, and actually Tom Kepler, developed over the last 4 or 5 years, and that's what we call the B-cell lineage approach to vaccine design. And basically one gets samples, B-cells, and separates them and studies the evolution of the antibody response in individuals that have either had an infection or have been given some sort of vaccine. And then these antibodies can be characterized to see how well they respond. That is, do they neutralize the pathogen? Do they bind it up, trap it, if you will, aggregate it? Just what characteristics those antibodies have. Once one understands that, can work with the computational biologists and design immunogens to try to go back and elicit those immune responses. And then those immunogens that are put together can be used in animal models to see if they work and behave the way one thinks they should respond as part of the development process. So some of you have seen this slide or a version of this slide before, and the main tool to that is a system that has sort of been developed by Larry Liao and Tony Moody in our institute, drawing on expertise that others have published on over the years. But it's basically a high throughput approach to identify cells. In this case, these are cells that are showing reactivity to 2 different flu antigens, single sort them, and then do RT-PCR to get heavy and light immunoglobulin genes. They can be then put into what we call a linear cassette and then put into a cell line. And within about 7 days, one can have a cell line that is producing antibodies in small quantities from this individual cell that we can begin to characterize and understand how it behaves. So basically, this is a cartoon to show one day, from the day that you get the sample, it takes you about 1 day to do the sorting, about another week to get all of the PCR work done to understand immunoglobulins that are present in that one cell, and then about 5 days of sequencing activities, and then about 72 hours, once you have this cassette built, you have cells that are producing this antibody in vitro that one can go characterize. And what you would have is you'd have a panel of antigens that you would then test these antibodies to see how they're reacting or are they neutralizing. Typically with HIV, what we do is we have HIV that grows well, and we look to see if these antibodies can neutralize that growth. If we have an immunogen, if you will, or an antibody of interest that comes out of this process, within 3 to 4 weeks using this approach, we can have milligram quantities of material that one could then go to animal studies. So we believe it's a platform that enables one to ramp up very quickly to emerging pathogens that we may be dealing with in the future. And this is sort of the pathway that one would go if you use, that is the development of the monoclonal antibodies in vitro through the high throughput screening process. And then once you have that, you could go to testing that in animal models. Now, how would we do that? Well, Singapore has a BSL-3 facility in the northern part of Singapore that they recently opened, so they can do exposure studies in animals there. We have a BSL-3 facility here on our campus. Lin Fa Wang, who joined the Singapore team, came from Melbourne, and he still has privileges and a partnership at a facility in Melbourne where they have BSL-4 animal challenges models. So we believe we have a network in place, either in Singapore here or Melbourne, that we could perform these animal testing models, and then depending upon the outcome of that, then one would decide would they go to proof of concept human trials. Locally, and we hope to leverage these resources to this model, or this center that we're creating. So we've developed a lot of regulatory experience at the Institute, barring on Bruce Burnett's team from the DCRI, QA and QC from Marcella Sarkozy's team in the CFAR. We've leveraged that into the Vaccine Institute and a number of our ventures. We have a good IP team. We're now a lot of us are doing GCLP work, and we are now overseeing GMP production of a number of these immunogens for HIV trials that will go out into HIV trials in the next couple of years. And we think some of these small proof of concept trials eventually can be done here at Duke. And we're beginning to think about that more closely. And why we can do that is last year, Chip Walter received the DMID out of NIAID, Division of Microbiology, Infectious Diseases section, a vaccine treatment evaluation unit. Well, what that is that's for anything that's non-HIV related. So that is, they don't get involved in the HIV trials. There's a whole other network, the HVTN, that follows that. But this group you can propose concepts to them. If they like the concept, they will help pay for manufacturing. They'll help support the clinical trials process. As part of our application, we partnered with Singapore to have an international team that we could draw on, depending upon what agent we were looking to bring, what countermeasure we were looking to bring forward. At the Institute, while we're academic, we've developed a management approach over the years that is more similar to a company, and we call it a modified matrix model of management. And basically, you have programs, if you will, coming down here, and then you have a number of teams, if you will, that cross over to help move those projects forward. We're proposing the same model would come in play between Singapore and Durham for the Center for Countermeasures that we're proposing to develop. Where are we in the timeline right now? Well, we have approval out of the Lin Fa's group to begin recruitment for a faculty position that will head the laboratory there. So we're right about here. We're writing a job description now. We hope that will go live by the first of the year. It would be nice to think by September, maybe October, we could find someone that would like to go spend a couple of years at least in Singapore, help develop the laboratory operations. What that would require is someone would probably spend a significant amount of time, 3-4 months or so here in Durham, learning the platform that we've developed here, and then helping to make the lab operational. And then, we have a lot of facility requirements. We have a lot of issues with permitting. How can we have everything in place that we can rapidly move samples around? When an epidemic hits, you can't spend 6 or 9 weeks to get permits in place to send materials around the world. You have to have all this agreed upon up front. So ultimately, there will be IP issues between Singapore and Durham. We need to work through those. So hopefully, while we're recruiting faculty, we can be working on some of these other details. And then if all goes well, we're hoping that within the next 18 months or so, we can become operational and start to get samples through this facility, and then start to develop a long-term plan for support of it. We think the initial funding will come out of Singapore Ministry of Health. The dean at the NUS facility is working on that now. Lin Fa is working on that. So some of this is sort of a work in progress, and stay tuned. This is just a small list of the folks that have worked on some of the important pieces of the science that makes this possible for us to go forward, and then we could not have done it without the incredible support from the NIH for all of our programs at the Institute. So I think with that I'll stop, and I'll entertain any questions about what we're hoping to create.
Questions for Tom? Ken?
Tom, one of the efforts I know that was a real downstream effort that I thought was always impressive, that you guys had a relationship with Novartis. Has that changed now that Novartis has sold out to GSK? Because I think that's a tremendously valuable asset.
Yeah, I didn't mention that. So we still have it. So what Ken is alluding to, about 3 years ago, we at the Vaccine Institute signed a partnership with Novartis Vaccines, and specifically their Holly Springs plant. And I don't know well, flu vaccines are traditionally made either in egg or more recently in cell. And if you have to deal with an epidemic or a pandemic, surge capacity when you're dealing with eggs is slow. So cell-based technology, you have cell cultures going all the time. You can ramp up quickly. So BARDA, a federal agency, invested close to $1 billion, I think it was, in Novartis to create this cell-based technology in Holly Springs. Well. And we signed a partnership with them in that they did not have BSL-3 capabilities there. So we signed a partnership that in the event of a pandemic and surge capacity was needed, we would work in partnership with the Novartis team and our RBL to help identify some early seed strains, seed lots, if you will, that would then go out there and potentially become the vaccine. And we spent probably about 9 months working out a master agreement between Duke and Novartis on all the IP, all the sharing, the cost of how that's supported. Well, very recently, Novartis has decided to liquidate its vaccine enterprise to GSK, right? Yeah. And the one thing they did not do was they could not release the flu part of it. So they're still holding that portfolio. And the reason is BARDA specifically invested in them because they wanted the U.S. to have capacity and multiple approaches to making vaccines. And they don't want any one company to be able to say, well, we like egg versus cell, or we like cell, because you never know when you're going to need both. So, that partnership is still there. We are cautiously optimistic that it'll remain. As of April this past year, they re-signed up for another year. So we're hoping that that stays in place. But leveraging that model is important. And the other thing I should mention, and I didn't mention, when you're trying to ramp up, there's another very innovative technology out there that we're thinking about how it could come, is that the tobacco industry. There's a company right here in the region that can make several million doses of a vaccine in about 2 months' time from the time that they have the, if you will, the insert for that. So that's another approach to dealing with these types of ramp-up, and you can use that model for both antibody or immunogen-based vaccines.
In tobacco plants?
In tobacco plants.
Yes, Julia.
You talked a little bit about having the import-export permits for samples, but what about your regulatory as far as animal studies and being able to do those quickly? Has there been anything to see how long that will take? Is the Ministry of Health helping to move things along in that, and what's your timeline?
Well, so that part is a lot of work to be done. So at this point, the question is, so a lot of the initial funding for this will most likely evolve out of Singapore, and a lot of work that we're proposing will be done in Singapore. We think that we think in the model we'll be able to easily move around immunogens or bugs that we isolate between here and Singapore. But the current thinking is that if we can do the animal studies in Singapore, we would do them there, probably. If we couldn't, then we would look to come here. And then depending on the pathogen, it may not even be Duke or Singapore. It would be Australia in a BSL-4 setting. We have a list of a lot of things that we need to work on, and that's just one piece of the permitting process. The first part is to be able to get, for example, from Chris Woods' sites, get samples from all those sites to be able to flow quickly into either Singapore or here. And that in itself, as you all know from dealing with live samples from individuals, can be a major challenge. So that's the first part we're looking at. And then how much material, because for some things, you may want to have another sample as opposed to a peripheral blood sample. But we're starting with simple things like peripheral blood. And basically, I would say we're not trying to reinvent the wheel. We've all have a lot of experience from the HIV work we've done over the last 20 years, and we're going to try to draw on those experiences and see if we can't recreate the model for this.
Other questions? Okay, Tom, thank you.
Thank you, John.